Hello, everyone. It's Cathy. I am joined here with Ellis today, and we we are so excited to be here live to answer your all's questions. So instead of kind of our normal thing where we're playing Nurse Squad or doing, a specific activity, previously when we've done those things, people have questions that we don't necessarily have time to answer. So we scheduled this today so you can come with your questions and we can basically talk about whatever it is that you guys want to talk about. So you guys may recognize Ellis. So Ellis does all of our skills videos, which are like the most watched videos on YouTube. So on our YouTube channel. So Ellis does a great job of just explaining everything very simply and very straightforward. And I hope you guys have enjoyed those videos and found value in those videos. And then, so Ellis, what's going on? So Ellis is also a teacher and a faculty, and not like an advisor too. Tell everybody what you do there.
Yeah, I am a full-time nursing faculty. So technically my title is senior clinical educator. So like a professor, but not technically a professor. And in that role, I do all kinds of stuff. I advise students. I help students with schedules. I'm also the student success coordinator. So I do things like private, not really tutoring, but discussions about test taking strategy or study skills, or how do I prepare for XYZ. And then in the program, I primarily teach health assessment. I have taught clinical skills for a number of years. I teach fundamentals. I have taught geriatric nursing for a couple of years. I just passed that on to somebody else. And I also run simulations. So I work in our simulation lab. I'm a certified simulation educator. So a special love in my heart for lab work of all kinds: simulation, health assessment, clinical skills, specifically that kinesthetic small group hands-on learning. It's just so fun. It's just so fun.
Totally. Well, in that first semester when you're learning those skills, or even just in the subsequent semesters, like it can be really nerve-wracking. Like I remember just being, I remember everybody being pretty stressed out by a lot of the skills checkoffs and just being super stressed out. And because you can easily fail if you break sterility, like all those things. It's just, I don't know. I think it's one of the hardest things about being a new student. It's just that whole skills lab and passing your skills checkoffs and not like freaking out.
I think I love it because it's like that first moment, a lot of students feel like a nurse, right? We get to use our stethoscopes. We get to put on gloves and touch equipment. Like that is the first like real nurse vibe that happens. But for sure, I think the vibe of the faculty sets up the vibe of the checkoff. Like I try really hard to make it feel low stakes, even though it's not. Like you can fail it and you can fail out of the class. But if I'm standing over you, breathing down your neck, you're going to be more nervous and you're going to make more mistakes. So I think a lot of it has to do with just the general feeling in the room. But
totally.
It's a lot of like high stress.
Like a reassuring smile or whatever it goes a long way. I've definitely had some professors that have scared me more than others when I was in nursing school.
I think some of them see that as like a rite of passage, right? That I have to scare you and intimidate you. And that's just not, it's just factually incorrect. I do not have to scare anybody.
You do not. And then there's the whole like talking to a mannequin, do I like answer for them? Like, do I have this like two-way conversation or it's just very awkward, right?
Yes, for sure.
to do that. Okay, well, welcome. So Sherry, how do I study fundamentals and holistic? I'm not sure what the holistic part of that is.
I'm not sure what holistic is referring to either. If you could clarify, that might be a class title that you have. So I think that's important to point out. All nursing programs call stuff different things and stuff is in different orders. Most of
Totally.
us obviously have fundamentals at the beginning, but all the other stuff, programs pick and choose where to put it. So I'm not familiar with if that just means holistic nursing, or if you have a class that's called holistic, which sounds super cool. I'd be interested in teaching
That
a
would
class
be a
that's called
cool,
holistic.
right. I'm guessing it's in a class title that they have, but fundamentals, we actually, okay, holistic
Holistic
assessment.
assessment. Oh, that must be like a health assessment class that they're not just doing the physical head to toe, which I love. I'm here for that.
Totally. Because, yeah, you really want to be assessing your patient in a holistic way and not just, I'm going to take your vital signs in this, right? You got to find out more about what's going on with your patient. But in terms of fundamentals, we have a complete fundamentals video playlist on YouTube, and we have our fundamentals flashcards. So we definitely have a lot of resources to help you with fundamentals, which I think are particularly valuable because I think when you're a new nursing student, it's sometimes hard to figure out where you really should be focusing your time. What are the most important topics and things that you really need to concentrate on? And that's where we can help you, because your fundamentals book is probably this thick. I mean, I think most
So I
fundamental.
have 3 or 4 different ones right here, and they're all this thick.
Totally. And you honestly you don't have enough time to read every word in that book, nor is that a really great use of your time to read every single word in your book. So your book has like valuable information, but you really need to know where to kind of focus your time. And our videos on fundamentals, coupled with our flashcards, kind of help you hone in on that key stuff that you definitely have to know and that you will definitely get tested on. So, so we definitely have fundamentals resources. And oh, do you have any tips on how to get through a lot of reading?
As I
Do you
think
have
that
any?
segues well into reading. You should not read a textbook like you would read a novel. It's 2 very different types of reading. There are very few humans that can read a textbook cover to cover and have absorbed any information. I would guess that many of you sit down to read a textbook and you read the same sentence like 5 times, and then you're like, I have no idea what's happening. And that's usually because you're trying to just read it like you would read for pleasure. And if you're reading for learning, you should have a goal or a specific purpose in mind, right? And that's actually why chapters generally have outcomes listed at the beginning, or your syllabi do, or your lesson. Somewhere there are outcomes, or even like if you're taking notes and you write your own like topics, those are the things you should use to guide your reading. I, in many, many, many years of schooling, have never read all of my reading, like cover to cover, front to back. I pick the topics I have questions on. I look at what the plan is. I use like the broad topics from another resource, like a study resource, like Level Up RN. And I look while I'm reading the textbook, I'm thinking, okay, what was this thing that they mentioned in class? Or what was that flashcard I forgot and had to look at 5 times? Or, oh, this is bold text. I should look at the bold text. Don't ever feel like you have to sit and read 5 chapters. It's just not
Totally.
possible. Our brains are made that way.
Totally. And a great way to like use our resources, and what I tell people, if you have our flashcards and our videos, if you know what topics your teacher will be covering and what topics you were assigned to read in your book, if you watch our videos on those topics and review our flashcards, which kind of give you the highlights and the key stuff you have to know. If you look at those things and listen to our videos before you go into class, then when you hear that material, you are hearing it for a second time. And that is going to help
If
that
y'all would
information.
do that, I'm just.
But you will learn it at a much deeper level because
I had a junior this year tell me,
Yeah.
maybe I should be looking at my stuff before I go to class. And I was like, what a concept. Like I haven't told you that 50 times. And I know that like nursing school, it's like this never ending barrage of content. And you feel like you have to study for the test that's on Tuesday, not the new content that's on Tuesday. But if you can just quick review, like our video, it's a quick snapshot of the topic, gives you a good basic understanding, because then when you come to class, you're really actually able to engage with your faculty and have questions prepared and know how to answer some of those more basic questions. It's just your learning experience will change dramatically if you even prepare a little bit before you come to the class.
Just have some basic kind of understanding, because if you're hearing it for the first time, because if you can't keep up with your reading assignments, which is very easy to get behind on that because it's a ridiculous amount of reading that you're assigned, then you're showing up to class with like no like foundation, no idea like what's going on. You hear that, it can be kind of confusing or come at you kind of fast.
Well, then I think students feel this panic of having to write down word by word exactly what's coming out of my mouth. And I'm like, first of all, what is coming out of my mouth is from your textbook. Like, what I'm saying is not new or magic information. You don't have to write word for word what anyone is saying. But if you've heard it before, I don't think you have that panic of I have to write everything down, because you're like, oh, I can look this up again. This is a moment to experience together.
Right. You're just listening and having that deeper understanding versus like trying to get it all down and learn it for the first time. So, and really that's where our resources can really help you do that in a really effective way. And before I forgot to mention that if you are thinking of our resources, we have a really great promotion going on right now. With the purchase of our Ultimate Nursing School Survival Kit or our Comprehensive Nursing Collection, you get a free year of membership. And if you don't need all of those decks, if you buy a single flashcard deck, then you get a free month of membership. So that promotion is going on right now. I don't know for how long, but definitely take advantage of that if you're thinking about some of our resources. And then the other thing I forgot to mention at the beginning of this is that we're going to be doing some giveaways today, because that's how we do. And exactly, we are all about the giveaways. So two things we're giving away today. One is our basically like a skills kit. It's actually not even for sale on our website. Well, this is our clinical skills flashcard deck. But what we're going to give away is our clinical skills flashcard deck with our kind of like this great little
skill swag bag.
Yep. And in there, we've got a watch, a great little washable watch with a second hand, so you can be counting those respirations, everything. There's a really high quality pen light in here. What else we got in here? Scissors. These are awesome scissors. So as a wound care nurse, I always have these scissors. So love that. And then little Sharpie. What is this? Mild liner, little highlighter for you for when you're doing your reading. And then a S-Gel pen. So all this great stuff in this really nice bag. Going to give away one of these today, so definitely stay tuned for that. And then the other thing we're going to give away today is a free year of membership on our site. So if you guys are not familiar with our membership, it is normally $10 a month or $99 for a year. And as part of membership, you get all of our core content videos without ads. You get our cram courses, which help you kind of focus in your studying as you're preparing for your exams. We have or the NCLEX, absolutely. Totally. We have our dosage calculation course. We have so many other courses too, ABG interpretation, EKG interpretation. If you need to get contact hours, we have, I forget how many, we have many courses.
30 hours, I think, total.
Totally. And then we have over 1,000 review questions as well to help prepare you for school, for the NCLEX, whatever it is you're preparing for. So that's kind of what our membership is all about. So like I said, you get a free year with the purchase of the nursing school survival kit, as well as the comprehensive nursing collection. Okay, so back to questions now. Someone's asking, would you say psych nursing is the hardest clinical rotation and course? I mean, for me, I found it, I would say no. I think it really depends. It just
I
depends
think
on,
these questions are always so hard because the answer is always, it just depends.
right. I personally feel like peds was probably one of the hardest courses for me. So
I
psych
think
was
I
really
found peds the most difficult as well. We had peds OB combined and it was like split in half. And I think peds was harder for me. I think a lot of it has to do with what you're interested in. If it's a topic that you're not super in love with, it's so much harder to get involved and engaged with it in clinical and class. And I do think that that is psych nursing for a lot of people, probably more so than it is for OB peds. A lot of people like OB peds versus something like psych. But is it hard? I don't know. Kind of just depends.
it can, I mean,
Different.
some
I'll
of
say
it
the
is.
clinical rotation's totally different than every other rotation you're going to do.
Oh, yeah. And I don't know that every school is fortunate enough to have good psychiatric clinical rotation. So my school, when I was going to school, I was lucky enough to do a rotation in a behavioral health unit that had like a intensive care section of it and a regular section.
Oh, like inpatient?
Yes, it was an inpatient behavioral health unit. And I mean, so just interesting little side comment. So one week we took turns like going into the intensive care of that unit. They lock you in there, like it's locked. But I don't have a key. Like I'm locked in there as a nursing student and that was a little uncomfortable, right? But I will say this about my psych rotation is I read about bipolar and schizophrenia, and it's one thing to read about those conditions. It is quite another to see it in action, to like, and I remember like, okay, now I get it. I know what mania looks like and feels like now because you read about it. But like I was talking to a woman there who was at the behavioral health unit. And at first she just seemed really talkative and enthusiastic. I was like, I don't see anything wrong here. But then like, it just didn't stop. It was exhausting. Like I couldn't even imagine how exhausted she was. Right. Like it was like just to see that. So it was really, really valuable for me to do that rotation, to really understand those mental health disorders. Versus just reading about them. So
As I do, someone just commented that their rotation was in a dementia and Alzheimer's unit, which is a great experience too, but I think is a very different experience than an inpatient psychiatric facility. Like that is the goal rotation, but I mean, patients can't even get placement in there, let alone nursing schools. So
right, that is so true. That is so true.
There's not enough places that have them. So it's sad, but not surprising that many schools probably don't get that experience.
For sure. Okay, Anastasia's asking, I'm getting ready to take my HESI exit. Any tips? Yes. So our videos and resources can help you kind of master and understand that like underlying material that you need to know for your HESI exam. But you also need to couple that with practice exams, right? So if your school uses HESI, then you need to do any HESI practice exams that are available to you as part of that program. If your school uses ATI, then you need to do the ATI practice exams. And if your school uses Kaplan, then you need to do the Kaplan practice exams, because practice exams should be really a super important part of your preparation. One, because if you take enough questions and take enough practice exams, you'll start to see trends and things that are asked repeatedly. And that will let you know, okay, yeah, I guess this is really important. It's really important for me to know these certain things because they keep showing up over and over again. Two, as we all know, or you guys probably know, nursing school exams are tricky and they're unlike any exam that you have taken prior to nursing school. I remember the first nursing school style exam I took where, there's questions like, what is the nurse's priority action for this patient with these set of circumstances? And like every single answer is something good and appropriate to do for the patient. And I'm like, I would do it all, but nope, you have to pick the one priority action. And I get so frustrated because I was like, I can do multiple things. I can be like telling somebody to do this as I'm doing this other thing, right? Like I hated like having to pick that one answer, but that's what you have to do. And then you have your select all that apply questions. Answering those type of questions takes practice. It takes practice. You're not going to be great at answering those questions right out of the gate. So taking practice exams is definitely a key part of preparing for your exit exam. So I don't know, Ellis, do you have other?
When you're taking a practice exam, which for a lot of these, if like your school's using a supplementary product like HESI or Kaplan or ATI, a lot of schools schedule the practice exams and make you take them. Take it seriously. I have so many students that are like, it's just practice, like it's not really worth anything. Then the feedback's not helpful. If you don't actually take it seriously, then what it tells you afterwards is meaningless and you just wasted 2 hours clicking buttons. So like put some effort into it, prepare for it, actually review what the feedback is. And then when you are doing things like preparing or taking practice tests or whatever, you should be remediating correctly. I think that what a lot of students consider remediating is they look at what the right answer is. And they're like, oh, okay, I got that one wrong, but that's the right answer. Next. And they move to the next one. But like, I did not waste my time writing a rationale for you to not read it because the rationale, not just why is the right answer right, but why are the wrong answers wrong is
you got to read all of it.
Really meaningful because you're not memorizing answers to questions because I'm gonna ask you a very similar question, but it has a different answer because I changed one word in my item stem and the answer is different. So you cannot be like, oh, that's the right answer. Next, like, why is it right and why are the wrong ones wrong? Then you've really remediated and learned. This is how I would answer a question that's asking me blank.
Well, and even the rationales for the wrong answers and stuff have nuggets of information that end up showing up as the primary question or whatever.
I make that my question next time.
Right. So when you're doing practice exams, don't fly through them. You want to read everything. If you get it right or you get it wrong, just stop and read every explanation and rationale. And if you got it wrong, and you're like, okay, I really didn't know that, or maybe you got it right by guessing, then put that topic down on a document or piece of paper. And by the time you're done with your practice exam, you're going to have a study guide, right? Like those are the things that you got wrong that you didn't understand. And now you know what to go back and read in your book or in our flashcards, right? So taking practice exams is hugely important. All right. Level Up RN, cut the time reading ATI books. Right on. We're here to help save you time and help you focus on the right stuff. Let's see. You guys are wondering, when we're doing the giveaway. Let's actually have you guys sign up now. So we're gonna first give away our skills kind of deck and our little kit that I shared with you. So if you would like to win this, then in the comments, and I only want you to do it one time, because if you enter more than once, Angelina will throw your entry out. She is not about multiple entries. So one time in the comments, I want you to write, I've got skills, ! So I've got skills, put it in the comments, and then you'll be automatically entered to win this kit. And then once Angelina picks a winner, then I will announce it, and then we'll let you know how to get that, okay? So I've got skills if you want to win that kit, which is not available on our website, actually. So it's a kind of a special giveaway.
It's a one-of-a-kind swag bag. I don't even have it.
All right, so all-nighter. I hope you're not pulling all-nighters all-nighter. Thanks, guys. I'm so happy to be here. You don't know how much of a gift this is. What are your thoughts on next gen? Do you think it's better? Yeah, I actually, I do personally think it's better. I love the partial credit, which was not a thing when I took the NCLEX. I love that you are given the normal ranges for lab values, which is what you'll see at the hospital, right? I think that's great. I don't know. What are your thoughts on next gen? Do you like it better, Ellis?
Um,
Neutral?
I think I'm new. I, as a test taker, like it better. I enjoy problem solving questions far more than I enjoy multiple choice questions. So I like the case studies. I like the matrices. I think they're engaging, and I think that they are a good step in the direction where in NCSBN wanted to go, which is how can we better measure potential nurse candidates' clinical judgment, right? So going beyond, can they pick the right answer out of these four answers? And do they have the ability to make clinical judgment decisions? So I think those are really good at doing that. Overall, the US had an astronaut, like record breaking pass rates. So I want to say that the RN NCLEX was like nationally above 92 or 95%, and the PN NCLEX was above a 95 nationally. So, like, do I have feelings that maybe the partial credit is too forgiving sometimes? I don't know. I'm
Oh,
not,
man.
I would love for everyone to pass, but as an educator, I also feel very strongly everyone's not supposed to pass. Like, there should be a cutoff, there should be a threshold. It's a
The bar
safety
shouldn't
measure.
be too low.
But and I'm a little concerned that the current pass rate is really, really high. Which is good and surprising. In fact, I mean, usually when you change something, you anticipate pass rates to drop. Everyone nationally anticipated the pass rates would drop, and they're actually higher than they have been in a long time. So I don't know.
Okay. So it seems to be like the general consensus is that it's a little easier for test takers.
Yes.
The pass rates seem to be improving, right?
Oh yeah, yeah. And I really think students have a misconception that it's super different. It's not that different. Less than 20% is going to be the alternate items. Almost all of it is the exact same NCLEX that it's always been. It's really not that different, and you have to know the same content you needed to know before. None of that's changed. It's all the same base content.
Totally. Okay, yeah. So Ashley just did our contact hours on our membership site. So 30 hours done and done. And then yeah, people are commenting about what was most challenging for them. So someone else seconded the PEDS being a challenging course. I feel like people underestimate PEDS. For me,
It's like med surg all over again.
It is, but it's like med surg all over again, plus like all the growth and development,
Oh yeah.
At 4 months old, they can roll from back to front and all, like all of that stuff, right? It's so much stuff, and like immunizations and normal growth
And I
and
think in a lot
development.
of schools shove it into like half a semester.
Yeah.
That's a lot of content.
Totally. Okay, so all right, we have our winner of the skills kit. So that includes our flashcard deck, plus the little bag with our with the watch and pens, pen lights, scissors, etc. The winner is Moses Karumba. So I hope I didn't butcher that. And I'm notorious for butchering names and pronunciations. But I'll put there in the comment. So Moses, you just need to reach out to support@leveluprn.com and let them know that you were the winner here tonight of the skills kit. And then they will get your information and get that mailed out to you. Okay. Let's see what other questions we have here. Any tips on how to study pathophysiology? Yeah. So pathophysiology is actually included as part of our med-surg deck, as well as part of our peds deck. Anytime there's a disease that we are describing, like the signs and symptoms and nursing care, treatment, etc., we also include kind of a brief pathophysiology explanation. And in our videos, we also kind of break that down and explain that. So we can totally help you with pathophysiology. Definitely included as part of our resources. All right. Ellis, do you see, what did I just get entered in? You were entering this. We're going to do another giveaway here soon. So stay tuned for that. I'm just kind of scanning through the comments. Any tips for a job interview? I have interviews with the nurse manager and chief nursing officer. Do you have any? I never had I barely met the chief nursing officer.
Not once. I mean, like, I've been there for a long time, and the hospital made this big effort to like upper management be visible to the staff nurses. Then I met her, but I definitely did not interview with her. So I'm surprised. I wonder how big the facility is that you're interviewing with the CNO.
That's true. It may be a smaller facility. Yeah. So tips for a job interview. Of course, you'll be asked, and it really just depends on facilities. But typically, you'll get asked questions. They want to know how well you work with other people, how you have worked through a difficult situation with a coworker or somebody you work with. They want to know, that you're a team player, that you can work through these kind of problems, that you can overcome obstacles, that you are flexible. I don't know, Ellis, what other kind of questions would you anticipate?
Like, you can anticipate questions like that, and you can always search what questions will be asked in a nurse job interview. Practice them out loud. Like, you feel real goofy doing it, but get your partner or your mom or your bestie or your dog, I don't care. Like, practice them out loud, because it is so hard for most people to talk about themselves. That you get real uncomfortable when someone asks you that question. And if you haven't practiced, I think it's all the more harder. When I interviewed for the job I have now, I got real uncomfortable when they were like, they literally asked me, what makes you different? Why should I hire you? And I didn't know how to answer that. And I was real awkward. And this lady looked me in the eye and she was like, this is your opportunity. Do not be humble. Do not be embarrassed. Tell me, what are your best qualities? Brag about yourself. And that's hard for me. And I think if I had practiced, I probably would have felt more comfortable doing it. So practice out loud. As goofy as it feels, practice out loud.
That's really good advice, for sure. Yeah. And someone mentioned here, this is a really good one. They like personality. You could always learn the skills on the job, right? You can't teach positive attitude. You can't, this is super important.
Personality.
For sure. If you've got a kind of positive can-do attitude and you really like being a nurse and you really like taking care of patients and you like being part of a team, they can teach you.
Especially with specialty floors. We know you're not going to have all the skills. We're going to teach you those. We're going to make you go to a class to learn some of that stuff. I want to know that you can take basic directions, that you can take feedback is a huge, huge thing. If I give you give you feedback about making a correction to your behavior or your action, if you can't accept that, I don't want to work with you.
Totally. And you need to use the interview as a time to ask your questions about things that really matter, about, I don't know, breaks. Turnover. Turnover, ratios, ability to take breaks. Is this a union? Is this hospital a union hospital?
I would ask,
not?
Do all of the nurses take their lunch break?
Yeah.
And
it's just, go ahead.
Right. No, I was going to say, and I think new nurses especially feel uncomfortable about pay. Don't ever feel uncomfortable asking people how much money they want to give you. I have a friend that just recently, so like in our 30s, is still doing this. And I'm like, baby girl, we got to learn. Accepted a job without knowing how much they were going to pay her.
Oh,
And then
man.
was like, now I don't know how to ask because like I've already like been hired. I've done the paperwork and I don't know how much money I'm making. And I was like, why would you not know? You have to know that. So, and then I like this
Totally
comment
ask.
here. Do your research. What is the mission and goal of this hospital? If it's a religious institution, make sure that their mission aligns with yours. Like, do not work at a facility that has a different goal than you do. You will not be happy there.
Totally. Totally. And find out how long the orientation period is, how long you'll have a preceptor. Definitely ask all of those questions. And
Or
just
do you have the ability to change shifts? Because I know a lot of people like get their foot in the door with night shift, but they really would rather be day shift, or they have to do swing shift for 12 months or whatever. When do I get to change that is a good question to ask.
Totally. Totally. And then Ashley said here, I have displayed on the screen, I had a mock interview for a grade with a hospital, and I talked about their mission statement and core values, and they seem to like that. Yeah, I can see
They
them.
like it when you've done your homework. And they also know you've applied to 10 other hospitals, but trying to get the name right when you apply to when you're in person. I sent the wrong cover letter to 2 hospitals once when I was applying for my first job, and I still think about it sometimes.
Okay, someone has a question here. How can a nurse who speaks English as a second language be competent at work? Skills and language, how do they correlate in being a successful nurse? Well, the fact that you speak multiple languages is an asset. Like, that is a great thing and something I wish I had. And you can absolutely be competent at work. And if you just need, if it takes you a little longer, you just may need to ask someone to slow down or repeat what they're saying. But the fact that English is your second language doesn't do anything to detract from your ability as a nurse. And in fact, being multilingual is a huge asset and really a gift that will make you a better nurse, in my opinion. I don't know if you have anything to add on that.
Yeah, I agree. I work with many nurses whose second language is English, and sometimes it just astonishes me that they're so smart that they can work in the medical field in a language different than, like, I don't know if I could do it. Like, that sounds so hard to me. And I feel like they're not always given the respect that they get because, people misinterpret them as being uneducated. And I'm like, whoa, bruh, like, they're more educated than you are. Let's calm down.
Totally. Well, and a lot of students who have English as their second language actually really get a lot of value out of our resources because we kind of break things down simply. We try to speak very clearly. We're all about helping people, no matter what your background, your primary language, that's really important to us. And we take great pride at helping people like all over the world and providing our videos for free and making them accessible to really anybody who needs help. Let's see. I find it crazy how some U.S. nurses don't have unions. It blows my mind. Yeah. So I did.
It's a disaster.
I mean, so the hospital I worked at for most of my career was not a union hospital, but I live in California, and there are state mandated patient ratios, which definitely helps. But I did do a clinical rotation, or a couple of them, in a union hospital, and I will say it was pretty cool because those people get their breaks, and like someone will come to you at your like break time and get report, and you leave for 10 minutes. You have someone dedicated to taking over for you. So you get your 10-15 minute break, your half an hour lunch, and another 10 to 15 break in the afternoon. And I will say that when you are at a non-union hospital, you kind of have to, or at least I had to kind of arrange for my own breaks when possible, which
it's absolutely like you have to stand your ground and say, I'm taking a break now. Right. And they'll sometimes try to talk you out of it.
Yeah. I I didn't take breaks. I just didn't really find it to be really feasible. I took my lunches, and we definitely had a resource nurse and a mentor nurse who would take my patients while I did my lunch. But at the union hospitals, I was definitely impressed with the consistency of always providing those breaks and always having someone right there to take over the patients. So,
And in non-Californian hospitals, I averaged 7 to 9 patients on a med-surg floor.
yep. Yeah, patients do love nurses with their native language. Anytime we can connect nurses with patients who share that language, that is ideal. That is best case scenario. That doesn't always happen, unfortunately. And then, you get me trying to speak broken Spanish and be like, bien, no bien, and we have our translation phones too. So you can absolutely get on the phone and communicate with your patient that way. But I will say that every conversation then takes about 3 times as long.
It takes forever because you have to connect through the translator service.
Yep. Yowza, your breaks are negotiable. If you're not, that's
like, would my boss say that? Never. But will they strongly imply it? Yes.
Okay. So let's have people sign up for our second giveaway while you guys are putting more questions into the chat for us to answer for you. So our second giveaway is a year of membership. So that's a $99 value. And like I mentioned earlier, our membership includes all of our core content videos, without ads. The membership also has over 1,000 review questions. We have our cram courses, which are awesome, to do that focused review before your exam or before the NCLEX. We have our contact hours. We have our complete dosage calculation course, as well as EKG interpretation, ABG interpretation, lots more. So if you would like to win a year membership, then in the comments, one time only, I want you to put members only, ! Okay. We did that last time. Members only. I don't know. You're not old enough to know about members only jackets. Are you, Ellis? Do you know anything about I clearly remember those. Anyway, so put members only in the chat. And then we'll give Angelina a few minutes here to kind of pick a winner. So, all right.
Any other questions?
Yes, I'm kind of scrolling through here. Now's the time. If you have questions.
Nursing faculty.
Yep. Ellis is faculty. Ellis does all the skills videos. Ellis has a wealth of information. So if you want really helpful, non-judgmental kind of advice and stuff, Ellis is a great resource. So usually it's Maris and I on these lives. I'm really excited that Ellis could join today. All right. Let's see. I think there may have been some questions earlier that I maybe missed. Skills on the job.
There were a number asking us about private tutoring. We do not do private tutoring. Someone asked again. I personally don't. Level Up does not.
Right. But we have so many great resources specifically on our membership site too.
It's like we're private tutoring you.
It pretty much is. I mean, we are
courses. That's basically a tutoring session.
Totally. And if you go through those cram courses and you're like, I'm still not understanding this or that, then you can watch the more detailed video on that topic. We will get you the stuff that you definitely have to know and that you're going to be tested on. We're just going to help you focus on the right stuff. It's kind of our secret power over here. I'm going through here. Oh, so this is interesting. I enjoyed doing half a day of clinicals in the criminal side of the mental health facility. So Ellis actually did a stint as a correctional nurse, right?
I did. I worked in a maximum security facility that was specifically for violent sexual predators. So in my state, That is not part of the Department of Corrections, but after an inmate serves their time in the Department of Corrections, if they meet certain qualifications, they go to this it's like an inpatient rehab technically. But still maximum security, the whole 9 yards, pods and barbed wire and metal detectors. So that was actually my first job as a nurse.
Wow.
Mhm.
Just wow. That's a pretty different start to your nursing career than a lot of people have, for sure.
Very different. I loved it. I'm not gonna lie, it was a great job. State benefits. One of the least favorite things I had about it was the 8-hour shifts, and I had to work 5 days a week, and I wanted the 12 hours instead of the 5 8 hours. But
Okay, so here's a question. I just started nursing school this month. What is the best quality of students that you've had who also works while in school? Yeah, lots of people have to work while they're in school. I worked while I was in school. And yeah, it's a lot. And you have to really stay pretty disciplined and focused and do a really good job at time management. I don't know, Ellis, you want to answer this one since you're a teacher?
It's boundaries that I find most of my students struggle with. All jobs, especially those in the service industry, or if you're like a CNA or an LPN in the medical field, will push you to work as much as you can. And they often will guilt trip you. Oh my God, if you don't come in, you're letting the team down, blah, blah, blah. You have to have such good boundaries while you're in school. And when you're not working, sometimes work, and they say that that's doing nothing. We're not doing anything today because you're not working. No, I'm in school and I'm studying and I'm not working the night before I have clinical. You know what I mean? Like, and it's so easy for people to get talked into working extra shifts. And I get it. Like, you make more money. Like, I get it. But it's boundaries. That's the quality that a successful student that is working has, is saying no to the extra shifts and recognizing you don't have to be in class or at work. There is other time that you need to be you.
Totally. I was really lucky. I only had to work part-time, and my hospital, I worked as a transporter while I was going to school, and they were very accommodating and flexible with my schedule. So I was very lucky that way. And if you're able to find a job that allows you to have that flexibility, that's definitely going to be the best bet while you're going to nursing school. How did you succeed personally in your nursing school and in the profession now? Any tips? Well, I will say that honestly, I spent a huge amount of time in nursing school really mastering the material. I spent so many hours making my own flashcards and everything to do really well. And those are hours that I didn't spend with my family or anything else, and I can't get those back. So my perspective is our resources. If I had our resources when I was in nursing school, I could have saved so much time. I could have had a much better quality of life, because like our flashcards or videos just like get down to business and help you focus on that right stuff. When you're in the middle of nursing school, it's hard to know where to focus your attention. What's the most important stuff you really need to be paying attention to? And so anyway, we've done the hard work for you. So at school, I did really well, but man, I put in some crazy hours to do well. And then in my profession, I started off on med surg. I learned a lot. I did fine. I did well, but I didn't love it. I didn't love med surg. And so as soon as I was done with my residency program, my 9-month new grad program, I actually moved over to wound care. I'm a certified wound care nurse. And I love that. Like, I loved it. It was a great fit for my personality. So that is one thing I would say is wherever you start, whether it's correctional nursing or med surg or wherever, you may not end up really loving that path and that job. And that's okay. The good news is with nursing, you can go in a million different directions. So do not throw in the towel on nursing. You're like, man, I don't like bedside care. Great. You don't have to do bedside care. You can do a lot of other things in nursing. So it's really just about pivoting and finding a position that is a better fit for you. And that's what I did. Nursing, wound care, love it. Love the grody wounds, love the dedicated time with a patient for an hour or two. Like, I love that position. So anyway, that's my story. What about you, Ellis?
To be successful in nursing school, I would never have survived without my buddy. I feel like everyone has a like nursing school battle buddy, and Katrina was mine, and we neither of us, I think, would have graduated without the other one. And then I did practice questions until my brain fell out of my ears. Like, that was just what was the most beneficial thing for me. I was actually annoyed when I figured out that level up existed, because I would have used it if it existed when it was after I graduated, because I've been a nurse for a minute, but that would have been nice, man. That would have been so nice to have. And yeah, professionally, I think it's finding what fits you, and then also like not being afraid to, like, it's a boundary. My answer to a lot of questions is boundaries. You have to say no. You have to refuse things. You have to stand up for yourself. Like, that changed my career when I realized, like, oh, I don't have to do everything someone asks me to do.
Totally. Yeah. And a lot of nurses or soon to be nurses are kind of people pleasers, and they don't want to say no. Mm-hmm. But that's not being rude or mean or anything. It's just those boundaries. That's important. Yeah, for sure. How to break down the med-surg book for a much better understanding. I'll tell you how to do it. It's in here. It's right in here. So, yeah, go into these cards, and really, we've broken it down for you. We've done the work for you. We've put like just the most important stuff. We've put our cool chicken hints, our silly hints, to help you remember key information. We have text that is bold and red on the back of these cards, and that really indicates that those things are the most important things that you are likely to get tested on. So yeah, we did it. We broke it down for you. And then you can go back to your book to kind of get a more detailed explanation if you need it. But really breaking it down to like the key things, we've done it. So definitely check out the flashcards, check out our videos.
And the breaking it down, like someone asked about pathophysiology earlier. And what I always tell students, if you understand how stuff works, then you really know all of it. Right? If you understand the broken down pieces, you can make an educated decision about what the more complicated answer. Do you know what I mean? Like, if you got the building blocks down, you can educatedly guess about the rest of it.
Totally. Nurse residency programs kind of vary all over the place. Mine was 40 weeks long. I didn't have a preceptor that whole time. I think I had a preceptor for like 12 weeks, but then we had classes.
Most residency programs are formal residency programs now. I think that started like 3 or 4 years ago. They're a year.
Oh, is that the thing now?
In many facilities, it mimics medical residency programs. In a number of facilities, I love this. They let nurses rotate sites and rotate fields. You spend 12 weeks, like, I don't know if it's 12 weeks, but you spend X weeks on surgical, X weeks in the OR, X weeks in the ER. And at the end of it, you get to request your favorite spot. And basically the units fight for you too, right? Like, whoever wants you. So again, having a good personality helps you get the job you want. I love a residency program. I think that we are finally respecting the fact that, just like in the medical field, you cannot just throw a nurse out into a unit loose and expect them not to accidentally hurt somebody.
Totally.
I find many of my graduates do the year-long residency programs because most of them come with perks like capped ratios or the rotation programs or first pick for stuff or sign-on bonuses. Like, they come with cool perks that you wouldn't get if you were not doing a residency program. So totally. I'm a big fan of them.
Yeah, they're fighting for nurses out here. They're paying big bucks, like big bonuses for.
All right, let's all move to California.
You got to pay the rent out here, though. That's
never mind.
That's the downside. That's the downside. All right. Thank you for the great YouTube videos and flashcards. You got it. We are happy to help. Yeah. How do you know how to pick the most correct answer in a question? You're right. It is rough when all the answers, you got to think about what's going to kill the patient, really, honestly. Like a patient being in pain, obviously we want to treat pain. That's important, but that is probably not the right answer. That's not going to be the thing that kills the patient. So think about your airway breathing. Think about what is an expected finding for their diagnosis, what is unexpected. You want to look for the unstable patient, the patient with an unexpected finding, something that could potentially kill the patient, right? Versus something else.
Like too many nursing students sleep on test taking strategies. There are like real steps, like recommended steps on how to answer different types of questions. And y'all just love to wing it. Y'all just be like, if I know the content, that's enough. It's not enough when all the answers seem correct. Test taking strategies are so important. Yeah. And it's not enough to just learn what they are. You have to then use them during the test. Because I'll have students be like, I was using the strategies until like question 15, and then my brain melted and I decided I have to drop out and work at Starbucks forever. And I'm like, you have to actively engage strategies the whole time. And so one of the things I tell students, we give them blank pieces of paper. If your school lets you have a blank piece of paper and you can write on it, I tell them to write whatever their biggest issue is before, like, which is usually don't add stuff. Don't say what if. Don't read the question and be like, well, what if he has diabetes? If I did not tell you he has diabetes, he does not have diabetes. Stop adding stuff to questions. You can tell I've had this conversation a lot. So
don't change your answer at the last minute. Like, okay, if you thought through like this is the right answer, and then you're like, wait, but maybe it's that. I'll change it. I feel like 9 times out of 10, that is bad. That is a bad point.
I am never tricking you. This is what students do. They'll pick an answer and then be like, I don't know, that was really easy. I bet it's a trap. If you knew it and it felt easy, then you just knew the answer and just accept that and know in your heart that I did it. I got that one. I remembered that content. Sometimes we give you softball questions as a gift. So don't pick a weird random answer that we've never mentioned in class because you think I'm trying to trick you. I'm not trying to trick you.
Totally. Oh, and I forgot to mention, as part of our membership, we have like a whole test-taking strategies.
I think we have a test-taking strategy thing.
We do. Maris goes through that whole thing. It's amazing. So that is also part of our membership.
Like there are amazing strategies that you should be using during a test. Content is amazing. Content is required. But you have to, for a lot of especially higher level NCLEX prep level stuff, you have to be using test taking strategies. And I remember learning them in school and thinking like, those aren't for me. Like, I don't need those. But I did. Like when I finally got to like the NCLEX prep, I was like, oh, okay, what was that decision? We learned a decision-making tree, which I still think is a little bit goofy. And I like some of the newer ones I've learned. But it was really important to actually use a strategy.
Totally. So speaking of test taking strategies, which is part of our membership, we are going to give away a free year of membership. And before we sign off here, the winner of a free year of membership is Crystal C. So Crystal C, you are the winner, So reach out to support@leveluprn.com. and let them know that you're the winner and they will get you all set up. And if anyone has questions, I saw a few questions about orders or whatever. If you have any issues with your orders, reach out to support@leveluprn.com and they will take good care of you. We have a really hard working team and they'll totally do what they can to help you. So yeah, congratulations, Crystal C. And thank you guys for joining us today. Thank you for all your great questions. And I want to thank Ellis for joining us today and providing your wisdom and advice. And like, I really love all the stuff you were talking about with like, don't add stuff to your questions and the need to take all those practice exams. So you guys go take your practice exams. get your strategies all together so you guys, can succeed. And we will be back. I don't have the exact date yet, but next time we come back live, we're going to play Nurse Squad. We're going to play fundamentals and health assessment. We're going to kind of combine those. That way, new nursing students will get a good review, but even students who are farther along in their program, you will always get tested.
Cathy, did you know what the lowest performing category on the NCLEX is?
No.
Fundamentals.
Yeah.
Infection control, chronically, the lowest performing is the early content stuff, because you guys are like, well, I learned that. Now I'm going to learn critical care. You still have to know infection control, you guys.
Oh, yeah. That fundamental stuff will come back to get you. And you're going to be tested on that stuff
forever.
From day one all the way through to the NCLEX. In your leadership class, leadership is basically fundamentals, like 80% fundamentals with some
You're just now brave
stuff.
enough to try it.
Yeah. So really fundamentals and getting, reviewing that stuff is kind of for everybody. So next time we get together, we're going to play Nurse Squad, fundamentals and health assessment, which everybody can benefit from. And hopefully we'll talk Ellis into joining us for a future live again, because it was super nice having you.
I don't know if I want to play the game and look silly on air, because what if I don't know an answer?
That happens sometimes for us. It doesn't happen often, but it does happen. And
you know what? I always stand by that. It's a good lesson for my students to know that I don't know everything either.
Yeah. Totally. Yeah. So, and if you guys have been on a live before where we played Nurse Squad, there's definitely some questions. I'm like, oh, which vitamin was that again? Vitamin B3?
Oh, vitamins? Absolutely not.
Yeah.
I teach that every year. I should be good.
Or Piaget's cognitive theory. I'm like, oh man, I flushed that stuff as soon as I got done with nursing school. But you have to know. Totally. All right. So join us next time. We'll get Ellis back on here to play too. I think that sounds great. So thank you guys for everything. Thank you for all the positive comments and support. We really appreciate you. And we'll see you soon.
We're proud of you.
For sure. Keep up the great work, guys. Bye.